I will now welcome Dr. Patrice Lindsey, Director of Systems Change and Stroke Program at Heart and Stroke.
Good afternoon, everybody, and welcome to our Heart and Stroke webinar. First of all, I'd like to thank everybody for tuning in and for the people who have tuned into our many webinars over the last several weeks. I would like to start today by acknowledging the land on which we sit, and I am here in Toronto. It's the traditional unceded lands of the Anishinaabe, the Mississaugas, and the Haudenosaunee. We're gathered today because of a shared commitment to equity and health equity in particular. By sharing this acknowledgement, we're showing our commitment to reconciliation and increasing our awareness of Indigenous history and perspectives. Heart and Stroke is focused on building meaningful and collaborative partnerships to improve health outcomes for all people. So I encourage you to reflect on what this acknowledgement means to you, to your work, and to the people in your lives and the people of Canada, wherever you find yourself as you listen to our speakers today. We understand at Heart and Stroke what unbelievable, unprecedented times we're living in. Nothing has been the same. People have been physically distancing, and for some people that's creating social isolation and other serious issues of, emotional changes, physical changes. So today's webinar, as well as our whole series of webinars over the last several weeks, has been to try to help you with your coping, with understanding what resources are out there, and to sort through the mountains and mountains and mountains of information that have been coming out at an unprecedented rate. We understand how confusing all that can be for most of us. So hopefully today, we encourage you to ask your questions. We hope that we can answer many of them. Wanted to let you know that at Heart and Stroke, we've been working hard to sort through all that information. As you can see on this slide, there's lots of different resources that we've made available to you. If you go to the Heart and Stroke website /coronavirus, you'll see many of those resources, and we hope you access them. Wanted to also let you know that today's webinar is going to focus on mental health issues and coping during this time. Next week, we're going to be focusing on physical activity and exercise and leisure. The weather has finally turned warm and sunny, at least here in Toronto, because it snowed last week. So we really are wanting to encourage people to get out, to think back about your risk factors, and to be active. So we're going to talk about that next week. And then the week after, we're going to talk about all the challenges people have been having with managing their medication and nutrition. Everyone's getting tired of eating at home and cooking and want to kind of change it up a bit. So we're going to have some great advice for you in a couple of weeks. I would now like to also let you know about our different activities. So among those things on the website, you'll find our podcasts. We just have a new one that's going to be released in a couple of days. And we're also running a survey to find out how else COVID has affected you. So we encourage you to complete our survey, and the link to that survey will be available after this webinar. Okay, so now let's get into today's topic. We know there are many unknowns at this time for people managing heart conditions, stroke, and vascular cognitive impairment, particularly all the information that's been coming out talking about how COVID directly impacts people with these conditions. With limited access to in-person healthcare and physical distancing requirements, many questions and challenges have been posed by our communities. We're experiencing all of these changes, but we are in it together. And hopefully today, we will help you feel like you're part of a bigger group and that you are supported. This webinar will provide practical answers to some of your questions. So please start submitting your questions into the question box on the webinar, as Kristen said. I now have the pleasure and honor of introducing our speakers. Our first speaker today is Sarah O'Brien. Sarah has been a tremendous advocate for mental health awareness, and she's a person who's experienced both a stroke and congestive heart failure. Sarah's been a very dedicated volunteer for Heart and Stroke, and we're so grateful for her incredibly generous giving of her time for us whenever we knock on the door, which tends to be a little frequently, doesn't it, Sarah?
That's okay, I enjoy it.
We're also very fortunate to have Dr. Jan Retav. Dr. Retav is a clinical health psychologist. He works at the University Health Network here in Toronto at the Toronto Rehab, specializing in cardiovascular prevention and rehabilitation, but has a very broad perspective on mental health issues, and he'll be a great resource for you. Our third speaker today is Margot Cobre. Margot is a social worker who's been working in the long-term care sector and in community with people who've experienced a stroke for many years. Margot and I go way back. She's a tremendous volunteer with Heart and Stroke. She's an incredibly knowledgeable person, really understanding the front line, which people with lived experience and their caregivers are experiencing, and will be a great asset to us today. So thank you all for joining us. I'm going to start with each of our speakers being able to introduce themselves a little more and share their thoughts with you about COVID and our current situation. Sarah, would you like to go first?
Sure. Thanks again for having me as part of this session today. I did want to first disclose that I have no conflicts of interest during this session. I did want to give you a little bit of background on my journey. So 3 years ago, I had a heart attack and congestive heart failure. I had to have an angiogram and a stent placed in my heart for an 80% blockage. After returning home after a few days, I was rushed to the hospital. I had a stroke when I was at home, and the TPA medication was administered. And during the procedure, I had a really drastic change to my blood pressure, and I ended up in ICU for several days. You know, as I went through this journey and this really stressful week of my life, nobody could really figure out what the problem was. And finally, about a year ago, I've been diagnosed with the lupus anticoagulant syndrome, which means I have sticky blood. So that means that my blood was so thick that that caused clogging my arteries, which just kind of made everything else happen. So I have a really good idea of some of the you know, anxiety and stress that might be happening to those that are at home right now during this very stressful time. You know, over the last 10 weeks, I think we're in week 10, there has been a lot of talk about COVID, and there's a lot of stress and anxiety out there for normal people that have no health issues. But for us, there's a lot more stress, I find. I just felt very, you know, worried, and, you know, my daughter would go to work and I'd be like worried when she came back, like if you touched anything. There's just so much to deal with. So I very much understand anxiety and stress that could be coming to all of you that have some pre-existing health conditions. Some of the things that I have started to do over the last, say, 10 weeks that I find are helping me from a mental health perspective. I try to be active, whether that means, you know, doing yoga in front of the TV, whether that means going for a walk at lunch or going for a walk after work. I find for me, it's nice to get outside, and it's when the weather's great, it makes me feel, you know, lifts that stress and anxiety, and it's a good way to kind of go out, even if you wanted to go with your family members that live with you, just social distance like you're supposed to, and it's fairly safe. Other things that I missed a lot of, and I'm sure everybody's going through the same thing, is you know, staying in touch with family and friends. It's very difficult, especially when we're told to stay home even more than the regular population. So I've been using, you know, the phone. I've been calling people more. I've been FaceTiming more. I've learned how to use Zoom and House Party so I can have a group of my friends together. You know, we've had drive-by birthday parties for my nephew when we couldn't all be together. We had a big parade to the cars. And my son and his wife are expecting their first baby, and they were supposed to be in Ontario this week, and they're not, so we're having a virtual shower. So trying to be very, I guess, what's the word, creative in how we spend time with people. The other thing I think is important is your mental health, and making sure that if you're feeling anxious or depressed, that you call out and reach out to those that you would have in the past. You know, if you have a therapist, I know my therapist takes phone calls. So those options are there. Talk to your friends, talk to your employee assistance program at work. A lot of businesses are offering even more assistance to you if you need help during this time. Also, our support groups, they're great places to connect with people, share what you're going through, and get some assistance. The other thing is I really found interesting for me was journaling. So I started to write down how I was feeling, and I felt that actually gave me an opportunity to get stuff off my chest. So I'd feel so much better after I journaled kind of what I was feeling, what I was going through, and helped me with my anxiety. And every time I journal, at the end of the day, I try to think about what are the most things that I'm most grateful for. Even though we're in this horrible time and we're, self-isolating and we're stressed, there are things to be very grateful for. So I always kind of ended it on that note for myself. And the last thing I'm going to say is you still have to listen to your body. Even if you feel like you're afraid to go to your doctor or something's wrong and you're afraid to address it, you have to address it. I actually had to go to my doctor's a few weeks ago and I had a throat infection, but I had to be tested for COVID, and I just had to go through it. I had to do the things right. I had to wear the mask. I had to use the sanitizer and be smart about it. But you can't let this COVID, ruin your health, because there could be a point where something is wrong and you're not addressing it. So, address yourself, figure out if you're not feeling good, and be kind to yourself. That's pretty much what I have been doing the last little while.
Thank you so much, Sarah. Those are great messages to share with people. And questions are already starting to come in, so that's awesome.
Okay.
Jan, would you like to comment next? Thank you.
Yeah, for sure. So just to introduce myself and my journey, so I'm a clinical and health psychologist, and my area of interest is sleep and sleep problems. And it was about 15 years ago that I started working here at UHN, the Toronto Rehab Cardiovascular Rehab Program. And I've spent pretty much the last 15 years working with patients who've had heart disease, whether it's a heart attack, heart surgery, congestive heart failure. But we also have programs for stroke patients as well as diabetics. So it's a whole range of different chronic health problems. And when I began here, one of the things I quickly realized is that stress, and this is all pre-COVID, but for our patients, the people that were recovering from various health diagnoses and challenges, that stress was a major hurdle, a major challenge for them. And so what I began to do here was running a program, and the program is to teach people skills in how to manage stress. So stress itself, I would say, is universal. I like to tell the patients that there is one group of people who don't have any stress in their lives, and from where our facility is here, you go down the road across Bayview and you'll see them all together there in the cemetery. So you don't ever want to join them unless you have to. And of course, that means dealing with stress in a way that's more functional. So the program that I ran was to teach them that you can do things to manage stress. And I think it's important for every heart patient, every stroke patient, and certainly vascular cognitive impairment, all of the patients that look to heart and stroke for guidance and education, for all of you to understand that your health issue itself is going to upregulate your stress system. And that's because the brain is constantly tuning into what's going on in the body. And if the brain is picking up that, you know what, the heart is limping along, right? You've had a heart attack and there may be some dead cells in the heart. The heart is struggling. And so what the brain does then is it upregulates your stress system. It says, okay, I'm going to give you a little bit of a boost so that you're not laboring as much, and it upregulates that stress system. And that's what we found in the research we do with our groups, that heart patients many times after their heart event are feeling much more stress. And it's not because things have changed around them with their family or their workplace, but it's because their internal system is making an adjustment and it's compensating for the problem that you're having. And that means that stress becomes more of an issue for you. And I've seen patients who tell me, I've never had a problem with anxiety, but now I'm having panic attacks and I have to go to the hospital. So we see that with great regularity. And it's because it's a kind of a collateral feature of having the health issue to begin with. So what I take from all of this, and what I want the audience to take from it, is that that stress itself is not a bad thing, and the way in which you and I respond to stress is really governed by what our autonomic nervous system does and how it responds to the challenge we're in. And there's basically 3 different states that autonomic system can rest in. And the one that we really want to be in most of the time is called ventral vagal state, where you're feeling kind of comfortable in yourself, you're feeling connected with those you care about, and you may even feel creative and you know, happy to be alive. And so that's where we feel socially engaged with those around us, and our brains function in a much more open way, and we're really excited about challenges that we face. But if we get into a slightly overload position where, you know, the challenges are coming too quickly and there's just too many things to deal with, we often get into this place of sympathetic drive, the so-called fight and flight response. And that's where you feel all of a sudden this sort of extra energy, and you're not sure exactly what to do with it. And sometimes you're also noticing it's harder for me to think and figure out a solution. And again, that's not by accident, because when you get into that sort of mobilized state, your blood flow to the brain, especially the part of the brain that, you know, helps you think and solve problems, is actually reduced. And that's because in fight or flight, your basic goal is to run away from the bear that's challenging you. So you don't really need to think in great detail, solve problems, or to do math or write poetry. You just need to make sure you're safe. And so we often find that we're not thinking as clearly when we're stressed out. And so that's the second state. And then the third state is kind of when you get to a place where you really feel, okay, I can't deal with this anymore. And that's a kind of collapse. It's a dorsal vagal collapse. And so your system is saying, I don't think I can run away from the bear. I don't know what I can do. So I'm just going to kind of just sit and pray and hope for the best. So those 3 states are very common for all of us all the time. And as we get through our days, we kind of shift back and forth depending on what we're facing and how much challenge we're feeling. But those are very common. And in all cases, you can do things to kind of shift out of a state and into a higher state. And hopefully all of us can use some of the strategies that Sarah mentioned. I love what you said about journaling and self-care. I think those are so important in kind of keeping in that kind of best ventral vagal state. So with that, I guess the only last thing I'd say is that all of us with COVID recognize that there is danger, and especially for patients who already have a health issue that is serious, that additional danger is not just a little additional, you know, challenge, but it can be a game changer, and it can become a life and death situation. And so it really makes the changing between these different mental states much more likely to happen and much more of a challenge. And hopefully the webinar can help give people some answers to those questions.
Great, thank you so very much, Jan. I'll now turn it on to Margot to make a couple comments, and then we'll get into the questions.
Thanks, Patty. Well, I just want to say that unfortunately the reality of the COVID pandemic is that the things that we have to do to keep ourselves and our loved ones safe are those very things that lead to feelings of fear and anxiety, things like social distancing and isolating ourselves. The other part of this is that the supports that we're used to having in the community are limited or unavailable, or if they are available, they're available with using alternative methods. So we might not be comfortable with virtual reality. It's not something that everyone is wanting or comfortable using. The other thing about it is when we have those limited supports, especially on our recovery journeys, that timely rehabilitation is so important. So not getting it and not having that timely care for you or your loved one, the person you're caring for, can cause a lot of worry and stress. And while you know, anxiety is a natural response to stress, it's still not easy to you know, to deal with all the time. So I think for people to be really aware of what they can control, what they don't have control over, and really knowing what their triggers are, what brings on some more of that anxiety and that fear. And just, you know, when we talk about the things we can control, I think it's really important to remember that it's your own thoughts and your behaviors and your actions that you have the most control over. So I know Patty had mentioned I'm a social worker. I've worked in long care community, but I've also been an unpaid caregiver, both for my elderly parents as well as more recently for an elderly aunt who recently had hip surgery. So, you know, I get the caregiving can be stressful in normal times, let alone during a pandemic. So I think we have to understand that we do need to reach out. Caring for ourselves is just as important as caring for our loved ones, because we're only as good and as strong as we are to help when we can help them. So I think that's kind of where I wanted to leave it.
Great. Thank you very much, Margot. I really appreciate that. We're going to jump into the questions. The first question is one that we at Heart and Stroke are very concerned about. We've been getting this over and over again. With COVID, people who are experiencing symptoms of heart disease or stroke are afraid to go to the hospital to get treated, even if they're having very acute symptoms and need medical attention urgently. They are delaying. And it's because of fear of COVID. So maybe I can get each of you to comment on that. So maybe starting with Jan, how can we help people understand the importance of getting urgent medical attention?
Okay, really good question. I think one of the things to understand about anxiety is that anxiety itself is a survival tool, right? And if anxiety is useful to you as a person, and let's say a bear happens on the path in front of you when you're out for a stroll, the role of it is to kind of make sure that you get away from that danger and get to a place of safety. So that works beautifully when the danger is a bear and it's in front of you, and that sense of procrastination or withdrawal and avoidance actually is life-saving. Now, if we kind of switch it to a hospital instead of a bear, you're going to understand that the hospital is where they have the experts and the equipment and the ways of diagnosing whatever it is that you may need in order to save your life. But paradoxically, you're feeling fear because of COVID, which is the bear, and you know, that's kind of telling you not to go. So I would say the first way of helping the person who's in that situation is to first acknowledge that they are feeling a very normal reaction to a very abnormal situation, but what that fear is telling them to do is really not helping them, because if they do have a health issue, a heart or stroke issue, they need to get into a place where they can be properly diagnosed and treated, and that is the hospital. And I certainly know from our hospital that there is many procedures that have been put in place in order to contain and to deal with COVID. So yes, patients with COVID do go to the hospital, but every effort is made to keep areas that are common areas disinfected. They are regularly you know, cleaned and worked through. So that natural response to the fear of COVID is something that the hospital is well aware of and is dealing with moment by moment all the time to ensure the safety of the patient. So hopefully that can help the patient understand that they actually need to go and make sure that they're looked after.
Fabulous, great. Margot, do you want to make any comments about that as well from your perspective?
Well, I kind of just wanted to say that, again, it's pandemic time, but I think this is a struggle for us in the stroke world, and certainly in cardiac and vasculars, getting people to go to the hospital even when there isn't a pandemic. So I think, we've been really trying to stress the importance that time is brain, that, the access to timely care is so important. And it is no different during a pandemic. And I think, as Jan said, the hospitals are doing everything within their power to ensure, patient and staff safety. And there's all kinds of precautions in place. And I would just, reiterate and say it will be anxiety provoking, but the best thing to do is get yourself the care that you need in a very, in a timely fashion.
Thanks so much. Sarah, the next question is for you. You talked about journaling, and Jan mentioned how that's such a great thing to do. The question has come in, do you share that journaling with your doctor, and do you find it helps you in managing your illness in dealing with health professionals?
I haven't been sharing it because it's something I started in March. But what I do think I do discuss it with my therapist. So like she'll ask me, how are you feeling? You're having anxiety. And for me, it helps me, like, kind of when I sit down and journal, I kind of think about, okay, so do I feel better today, or do I feel worse today? Or am I having physical issues, or am I having anxiety? So I do kind of talk to my therapist about that. And I could say, I'm most of the time I'm feeling very anxious, or, or I can see myself how it's like when I sit down to do it, I can either know it's going to be a great journaling experience, or I know I've had a really bad day. So it helps me kind of level set for my own self, and then think about what can I do differently tomorrow, and what can I focus on tomorrow to make me feel better if I was feeling better, feeling bad today. But I do share it mostly with my therapist, not really my doctor, but my therapist is kind of the one I work with on the mental health pieces.
Yeah, I would add a few things about journaling, that I think there's many reasons that we can journal. And certainly one of the things that I suggest everybody consider at the end of the day, to think back on your day and see if you can identify 2 or 3 things that happened that were really positive. Anything at all that happened. Maybe the sun came out when you were walking through the park. I mean, something that made you feel good inside. And I think that's kind of a personal, let's say, inventory of what I appreciate in the day. And it is important for all of us to kind of bring our attention to those good things when they happen, and especially at the end of the day, because you want to go into your sleep pattern not terrified about what happened, but appreciative of what positive things did happen. But the second point about journaling is that when you do go in to see your doctor, and I know now it's much of that is through video conference, but it is important to prepare yourself. And so, many of our patients have questions about blood pressure medications and so forth. And I urge them to, when they take their blood pressures, write down what they're seeing. If they're having problems, if they've gone through a number of days where they've taken their blood pressures, and they can identify, how things are maybe upsetting them, or they're not sure if this is the right medication or the right dosage. Most doctors are really appreciative to see the data, like what is it that's going on, and by taking a look at, let's say, a page of entries of what's been going on, they can easily figure out what they may want to do about it. And it's a good way also of preparing for the visit with the doctor, because you only have so many minutes, and you want to make sure you get to the most important things for you.
Yeah, and the other thing you mentioned that I wanted to quickly mention was the gratitude part of that. And there's lots of, when I first had my issues a few years ago, I had to often think about what I was grateful for at the end of the day. And I actually downloaded an app that was like a gratitude app that you could fill it in every day, and you could take photos of things that you were very, grateful for. So whether it's journaling or using your phone or taking pictures, there's lots of things out there that can help you do that.
Awesome. Thank you so much. Margot, I'm not sure if you heard the question that I think when we got frozen.
No.
People are struggling with physical distancing, with being told to stay at home and feeling really disconnected. Can you make some comments or suggestions on how people who are being distanced can avoid the social isolation and be connected with others, or to deal with that feeling of aloneness?
Yeah, it's a tough one, because I think the thing that we all seem to, turn to during this time when we're not able to physically be with someone is to virtual reality. And like I mentioned in my my opening statements, it's not always the easiest thing for people, but it certainly is the number one thing I would suggest. And I know that there are a lot of people who have never used technology, who during this pandemic have learned very quickly how to connect with their family. Just seeing people's face, even when it's not live, is so different than a telephone call or an email or a text. So I think if you can, teach yourself or teach your loved one, or have someone help you use technology, it's absolutely the best, the best way. And we are starting to lift some of the social distancing, parameters now. So it's a little bit easier to kind of get outside. The weather's nice, and we can have those drive-by birthday parties and things that Sarah mentioned. And I think it's just important to find ways that you can connect with people. I know in some communities they've done neighborhood dinners where people will put, a table at the end of their laneway, and their neighbors will sit around and they'll eat dinner on their own with their own family, but other people are out there and they're around, and they're not even necessarily having a conversation, but you can hear them. It's kind of almost like being in a restaurant again. Just things like that, being really creative, but definitely getting out, getting fresh air, seeing other people, trying to learn the technology if you can. Those are a couple of things I would suggest.
Awesome. Anybody else have comments on that or suggestions? Okay, we'll move on. So this one is for Jan. One of the big challenges with all the extra stresses and anxieties with the information overload with COVID is, some people reported having panic attacks or high anxiety attacks, but that the symptoms are very similar to the symptoms of a heart attack. And so they're not sure which it is. How would you help them, and how would you like to address that?
Okay, that's a really good question. And certainly we see that pretty often with some of our heart patients who come in here. And of course, many of them have, before arriving at cardiac rehab, have had a heart attack. And so they're really highly sensitized to the signals that it could be the same thing. So it is hard to tell, because when in a panic attack, for those who haven't had one, your heart starts beating very, very fast, and it's almost jumping out of your chest, and you feel sweaty and hot, very uncomfortable, and it's very typical to have very negative, I'd say catastrophic thoughts like I'm dying, or I'm going crazy, or something like that, because the internal state is so intense. And of course, when that hits, you definitely need to get to a place of safety. And if COVID were not happening, certainly it's important to get to a hospital to make sure that this wouldn't be a heart attack. And with the patients that I work with, I always tell them, look, your safety is most important. If there's a doubt, go to the hospital, have it checked out. Now, the other thing that I teach patients is how to do diaphragmatic breathing. So once a patient has learned how to breathe into the belly, and it's a really slow, gradual process where you bring the air into the bottom of your lungs, you pause, and then you take a nice, long, slow exhale. So you're breathing the air out through pursed lips. So some people call this straw breathing, where, you know, it's as if you had a small straw and you were pushing the air out through that straw. And as you're doing that kind of slow diaphragmatic breathing, you're actually affecting your nervous system. You're calming down the autonomic system. So the sympathetic, which I alluded to earlier, the fight or flight reaction, begins to slow down. And your parasympathetic system, which some people call your rest and digest system, is being boosted. So you're actually helping the brain and the body kind of get to a place of calm. And if you do that kind of breathing for 10 minutes, you know, give or take, usually you'll notice that that panic just kind of subsides. So obviously, anything that you can do to bring that sense of internal fear down and it starts to respond to it is clearly not a heart attack. Because if it is a heart attack, then you're going to continue to feel the symptoms because the problem is in the artery in your heart, and you could do all the breathing in the world. It doesn't change what's going on. Now, you know, for people who are not sure, I would urge them to err on the side of safety all the time, but to try and learn, you know, techniques and strategies like diaphragmatic breathing that can really do a lot to give them more control over this state of tension. And it will improve certainly their susceptibility to having panic attacks, but that may take a couple of weeks of practicing.
Thank you so much. And I think the really important message is, when in doubt, call 911. Please don't sit at home wondering which of the two it is. That the faster you get treatment, and if you go to the hospital, don't be afraid, don't be embarrassed if they say, oh, you know, it's not an actual heart attack. That's good news, and you did the right thing. So I think that's so crucial to know that it's not bad, and nobody's going to be mad at you for seeking help, because, you know, the other side of that is, if you don't seek help and it is a real heart attack or stroke, you're going to be in a much worse position, and nobody in a hospital will get mad at you for coming to be checked out. Margot, I'm going to turn the next question over to you, and then Sarah, I'd also like your response to this. This is a really common thing happening right now, is with people working at home and not being allowed to go work in the workplace, they have young kids at home, or they have elderly parents or others in the household that they're caring for. And for somebody who themselves have had a heart condition or a stroke, they're now at home with other people around that are expecting them to look after them. They're not leaving enough time for themselves, and that's putting them even more at risk. What is your recommendations or suggestions for so many people in that situation?
Well, I think probably one of the first things for working at home is to kind of organize your time. So, you know, really kind of trying to set certain times aside where you know that you have meetings, and then times where you may need to, you know, help the kids or help your parents, like around meal times or what have you. So build a schedule. I think too, just important things like really kind of things like humor and music that we can use during the day to kind of help us relax and help us kind of center ourselves. It's very difficult when we have so many things going on in the home to just kind of be overwhelmed. So the other piece of that is to have a place where you can go, a place that is just for you, that if you're working from home, you can you know, get away and have some peace and quiet, and that's kind of your space. And you know, make some boundaries with the kids or with whoever you're caring for, or whoever else is in your house, that this is, you know, this is when I need to be, you know, on my own. I need to have some space. Set those boundaries. I think it's very important to do that, because I think when we're at home so much, it just kind of, everything becomes, you know, so much more lackadaisical, and we're not as structured. And I think the structure is really important. And one of the things I thought about when we were talking about journaling was also around making lists, so that you you know what you want to accomplish on any given day. And even if you only get 1 or 2 of them done, it can be very satisfying to check off or cross off something on a list. So I think, you know, setting those boundaries, having a list, having some structure, those are some things that people can utilize to help them, you know, during this time of working at home and caring at home.
That's excellent advice. And I know I'm a sticky note. Actually, our whole mission team at Heart and Stroke are known as the sticky note junkies. I think we've set a few records at the number of sticky notes we've used at any given meeting. And those on our team who are out there know who we are. Sarah, do you have any other comments on that?
Yeah, I think one of the things that I would suggest to people is to talk to your employer. So for myself, I have folks that are in the US, and when I started to realize and when I started to hear them say, oh, I have to go grocery shopping on this Saturday when there's lots of people, and I said, okay, hold on a second. If it's easier for you to go on a Monday at 9 o'clock, then you tell me and we can make arrangements for you to go, right? Like being really understanding and flexible as an employer, but also it's up to you to tell your employer, you know, I need to take this time during the day to do homeschooling with my child because this is the time their stuff is on the computer. And I think most employers are very open to working with that. I agree with the lists. I'm a list taker. I love it when I can cross something off. The other thing is deliveries. Do your online shopping if you can, right? So that you're not having to go out and run around too much. See what you can get delivered. That will help eliminate a little bit of stress from you as well.
Yeah, and I guess the one thing I might add is something we do in our stress program here is we give our patients a 60-minute challenge. And the 60-minute challenge is that we want you to find 60 minutes every day for yourself. This is only for you're taking good care of yourself, whether it's physically, whether it's emotionally, whether it's socially. You decide how you're going to use those 60 minutes, but you need that as basic maintenance time to be healthy and well and to be able to respond to all the other demands. And what we have found through the years is that's really hard for many patients to do because they've been so used to being there for everyone else. And I think particularly for women, because they're expected to be the caregivers, that when we tell them to find 60 minutes, I mean, oftentimes they kind of say, well, that's impossible. I couldn't possibly do that. And yet, you know, if you try and achieve it or do something to protect that amount of time for yourself, it is worth it, and it will help you get through the other things that you have to deal with.
That's amazing. That's great advice from all three of you. Thank you. We have two more questions before we wrap up. The first one is for Jan specifically. A couple of people have approached us and said they're really nervous about doing virtual healthcare, especially to talk about mental health feelings, because they're worried about privacy. They're not sure who else might be listening in and how secure some of the networks are. Can you comment on that and maybe provide some reassurance to people?
Yeah, absolutely. I think it's really important because it is right now the only way in which most clinics or doctors are seeing patients. I know here at Cardiac, that's the way we provide service. I also have a private office and see patients there. So for the private office, I use the Zoom platform, but it's one that I subscribe to. So I pay Zoom for a fully encrypted mental health professional level of platform. At the hospital, we use the Ontario Telehealth Network, OTN network, which was specifically designed to be encrypted, and most doctors in Ontario are using that as the platform. So it is important to understand that every doctor, before they're going to connect with you, has thought about privacy issues and confidentiality issues, and that they've done everything that's possible to make sure that that consultation that you do have is fully private. I can also assure you from the work, because I do a lot of psychotherapy, a lot of work with people who've had trauma, sometimes very, very disturbing experiences, and you can use the video conference platform very effectively with people. In fact, one of the things I've observed is when people are talking to me from their own home, they often feel much safer. They feel like they literally are in their safe place, and they get to talk to me rather than coming to my office and journeying through the TTC and so forth. So it really does work better than what many people would think. So I would say give it a try, be open-minded about it, but I think you'll be really happy with the results.
That's great. Okay, final question then, and before we wrap up. So Sarah, you've mentioned stroke support groups or support groups generally. Can we end it with each of you talking about the support groups you know of, or how do people connect to them and the value they bring? Sarah, would you like to go first?
Yeah, so most of the ones I belong to are on Facebook. So they'd be the Heart and Stroke, they would be Community of Survivors, and there's also one for women with heart conditions. So those are the kind of the groups that I have joined. I've also, because I have APS, I also joined that group as well. It depends what you're looking for as to what kind of group you want to join. And you'll find sometimes you join a group and you don't really like that group, so you'll find something different. So I think it's really good to find a group online, and it's always easier to share sometimes, not in person. If you're going to kind of go out on a limb and share something, it's easier when you're at home and you're in the comfort of your own home and you don't feel like, you're in front of a group of people. So for me, all of mine have really been through Facebook groups.
Thank you, Sarah. Jan, would you like to comment on connecting through groups and the value of that?
Yeah, I think in terms of what we're noticing here at Cardiac Rehab is that many of our patients were quite nervous about just how they were going to manage the social isolation. And we did set up some groups for our patients here. One of the things that Dr. O, our medical director, has been working hard on is the Cardiac College. So the Cardiac College is a website which has a lot of information about heart health and about all kinds of things that one can do in order to support your health and well-being. And they've been running webinars as well. Most of them are taped and they can be accessed just the same as the Heart and Stroke ones. So there is a lot of resources out there that people can benefit from. And I think this is where Google can be really helpful, is just be open to, curious about what's available and explore.
Thank you. Margot, would you like to make final comments on that?
Yeah, so I just wanted to mention the March of Dimes After Stroke website. I know they have some really great groups online. The other thing is the healthline.ca. That's kind of a one-stop shop for any kind of community resources, programs, and it's all done by region, so it's very relevant to wherever you happen to be. And there is actually a stroke microsite on that Healthline. So I encourage people to look there, and then of course the Heart and Stroke website and their Facebook groups and Community of Survivors are other great ones. But there's nothing to replace that connection, and I just really encourage people to reach out, because we honestly don't have any idea how many other people are going through what we're going through until we become vulnerable enough to share. And then once we share and we realize that we are amongst many, it's a very gratifying feeling. And I would say I encourage people to be open and to reach out and not to hesitate.
Thank you. I'd like to, we'll wrap up now, and I'd like to thank all of our speakers, our guests today, Sarah and Jan and Margot. You've been fantastic. Thank you to everybody who joined us today for submitting your questions. I hope we've answered many of them. So just as a reminder, if you are having any symptoms of a heart attack or stroke or cardiac arrest, those are medical emergencies. Please don't hesitate to contact emergency services, 911 if you have it, and seek help. Even with COVID, the emergency departments, most of them are empty right now because people aren't coming, and they are there waiting to help you. Continue to join in. We have more webinars coming. Next week's on physical activity, getting back out into leisure. And again, that's a real important component. Exercise is a great component for mental health. So we encourage you to join in and learn some new ways to do that with the circumstances of COVID. So thank you all again, and we wish everybody well. Have a great rest of the day, people.